Alright, this is a PDF file downloaded off of cdc.gov about, it's called Emerging Infections Getting Ahead of the Curve. Center for Disease Control Prevention, Atlanta, Georgia. Alright. It starts talking about the early infectious disease, how it's characterized by sudden, unpredictable outbreaks, frequently of epidemic proportions. Alright. Then it continues on a little bit right here in the thesis. Has published, says National Academy of Sciences Institute of Medicine has published 3 reports that have identified erosion of the public health infrastructure among the factors contributing to new and re-emerging infectious diseases. Okay, you hear that? The National Academy of Sciences Institute of Medicine has published 3 reports that have identified erosion of the public health, erosion, like erosion control, infrastructure among the factors contributing to new and re-emerging infectious diseases. Okay, new and re-emerging, in partnership with many public and private organizations in the United States and abroad, the Centers for Disease Control Prevention has developed a strategic plan that addresses the priorities set forth in the 10 I0M reports and serve as a guide for CDC and its partners to combat emerging microbial threats to health. Laboratory-based surveillance, better communication networks, and improvements in the public health infrastructure are the cornerstones of the strategy. Emerging infectious disease. A new periodical produced by CDC will serve as forum for exchange information about incipient trends in infectious disease, analysis of factors contributing to disease emergence, and development and implementation of prevention measures. And it has a history of infectious disease. Now, where it starts getting interesting, and it says dissemination of infectious diseases intensified as civilizations progressed. Caravans of traders carried new pathogens to unsuspecting and susceptible. My bad. New pathogens to unsuspecting and susceptible populations. Dissemination of infectious disease. See how they use the word dissemination right there? Of infectious disease intensified as civilizations progressed. Caravans of traders carried new pathogens to unsuspecting and susceptible populations, which means they carried fucking drugs, motherfucker, pretty much. Compared with earlier generations, we possess an enormous scientific base, and the rate of acquisition of new information about infectious diseases is at a historic high. Moreover, thanks in large measure to effective childhood immunization programs, including the President's Childhood Immunization and Initiative, many infectious diseases are under control, particularly in the industrialized world. The elimination of smallpox in 1977 stands as a towering achievement in the fight against infectious diseases. Alright, let's see. Many infectious diseases are under control. Okay? However, many infectious diseases have perished and have displayed a remarkable ability to re-emerge after lengthy periods of stability. Yeah, I wonder why. Let's see. Even as the International Code of Disease places many infectious diseases in other categories, for example, meningitis and cirrhosis are classified as diseases of the nervous system and liver, respectively, and only 17% of deaths attribute to infectious and are actually included in the codes for parasitic and infectious diseases. So that means, they only allow fucking 17% of all the deaths to be classified as parasitic. The rest of them got different codes for different diseases that the parasite causes, is what it's saying. In the United States, each year, approximately 25% of physician visits and attribute able to infectious diseases with direct and indirect costs, including those for human immunodeficiency virus infection and related illnesses, estimated more than $120 billion. This shit's cost. New infectious diseases, often with unknown long-term public health impact, continue to be identified. Did you hear that? It says the increasing prevalence of antibiotic-resistant strains of, I can't pronounce those, and important of other serious treatment and control failures. Many other examples of emerging infections can be given new infectious disease, often with unknown long-term public health impact, continue to be identified. Continue to be, not was identified. Lyme disease, human, Legionnaires' disease, Lyme disease, human, still others are entirely new with some parallels to medieval times. A previously unknown and deadly disease, acquired immunodeficiency syndrome, which is AIDS. Clearly, the complete history of infectious disease remains to be written. Alright, here's where it starts. Getting ahead of the curve. Here's a perspective for you. Okay, your perspective. Recent disquieting infectious disease trends have not gone unrecognized. It means they know that we know they're trying to keep this shit quiet. Recent disquieting infectious disease trends, the trends they set to keep it quiet, have not gone unrecognized, and the similarity to earlier disease trends with immense global consequences has not gone unnoticed. Primary responsibility for addressing new and re-emerging infectious diseases rests squarely with the custodians of public health. Indeed, the fundamental maxim of public health must guide current prevention programs. The health of the individual is best ensured by maintaining and improving the health of the entire community. Core functions necessary to ensure the health of the public were defined in the National Academy of Science Institute of Medicine. Let's see, assessment of health status, risk and services, development of health policy, assurance of quality health services, surveillance. Assessment is the sine qua non of infectious disease preventing programs. However, for surveillance to be effective, it must be specific. Consider, for example, surveillance of viral hepatitis. Only after the virus agents of viral hepatitis were identified and specific laboratory testing became available was it possible to explain trends in disease prevalence and establish the epidemiological principles underlying the different modules of transmission. Specific laboratory testing is also the basis of screening programs that ensure the safety of the blood supply against hepatitis and hepatitis C. Agent-specific surveillance is a critical component of many immunization programs. Agent-specific surveillance. The United States has been dramatic. Similar approaches will ensure appropriate formulation of other developmental vaccines. Monitoring antibiotic resistance is yet another important example of the value of laboratory-based surveillance. We cannot overstate the role of behavioral science in our effort to get ahead of the curve with emerging infections. Having the science of laboratory technology to control infectious disease is not enough to control it, not prevent it, to control it. It's not enough unless we can influence people to behave in ways that minimize the transmission of infections and maximize the efforts of medical interventions. Intervening them requires important changes in lifestyle behavior. We must use our knowledge of human behavior to help people make lifestyle changes and prevent disease. Another illustration of the need to use behavior science is the problem of antibiotic resistance to a great extent. The problem is related to the behavior of both physicians and patients. Physicians continue to use antibiotics inappropriately, and patients continue to demand antibiotics treatment when it is not indicated, for example, for the common cold. The spread of infectious disease is exacerbated for homeless and drug-dependent populations. Completing a 69-month course of therapy for tuberculosis is difficult, and it really is delusional parasitosis, but they're using tuberculosis, you'll see in a minute. And the failure to complete the therapy increases the risk for drug-resistant tuberculosis in the community, which means drug-resistant psychosis in the community. Microbiologists, infectious disease specialists, and other basic and clinical scientists must collaborate with behavioral scientists in an interdisciplinary effort to prevent and control emerging infections. Prevent and control emerging infections. Not prior, not other, not re-emerging. Prevent and control emerging infections. Okay. The future of public health emphasizes the relationship between a sound public health infrastructure and infectious disease prevention programs. Preventing us to know about it, all they're preventing. That's it. You can't report it.